A research team in Rome tracked 44 men with enlarged prostates for 3 months. Half of them made one small change to their morning routine. They added a single ingredient, something you almost certainly already have in your kitchen right now, to a glass of tomato juice every day. That is all they changed. No new medications. No expensive supplements. No special diet. At the end of 90 days, the men who made that one change showed a 23% greater reduction in prostate volume than the group who changed nothing. Their urologists were so surprised by the speed of those results that several of them asked their patients directly, "What are you taking?" The answer was not a drug. It was not a lab-engineered compound. And the full combination cost less than $2 per day. My name is Dr. Mei Anderson. I am a board-certified urologist, and for more than 20 years I have specialized in the sexual and urological health of men over 50. What I am going to show you today is one of the most underused, most scientifically supported combinations in men's health. One that addresses the real upstream reasons so many older men experience declining erections, reduced sexual stamina, lost morning firmness, disrupted sleep, and a kind of faded vitality that nobody ever fully explains to them. It is not what most men think it is. And once you understand it, you will never look at this problem, or this ingredient, the same way again. Before we go deeper, if you are watching Vital Health Seniors for the first time, please subscribe right now and hit the bell. I publish new evidence-based content for senior men every single week, and next week I am covering the second ingredient that compounds this protocol significantly. You do not want to miss that one. And I want to hear from you right now. Drop your age in the comments, just the number. I read every comment on this channel. And at the very end of this video I am going to tell you something that will genuinely surprise you about why the results of this combination are actually stronger for men over 70 than for men in their 50s. So stay with me to the end. It is worth it. If you have been struggling with weaker erections, reduced morning firmness, less sexual desire, or less stamina than you had 5 or 10 years ago, what have you been told is the reason? Most men I speak with have been told it is low testosterone, or poor circulation, or simply aging. Some have had blood work done, maybe tried a prescription, and still felt like something important was missing from the explanation, like the answer they were given was technically correct, but somehow incomplete. I am going to tell you today that for a very large percentage of men over 60, possibly the majority, those explanations are treating symptoms, not the source. The real upstream bottleneck to sexual performance, erectile strength, and even daily energy in older men is an organ that almost never gets discussed in this context. It is not your heart. It is not your arteries. It is your prostate. I know that sounds unexpected. Most men think about the prostate in two situations: cancer screening, and when urinary problems begin. Almost nobody connects the prostate to sexual vitality or erectile function. But the anatomy makes this connection impossible to ignore once you understand it. And I am genuinely surprised every year that it is not discussed more widely. Here is what is happening inside your body. Your prostate gland sits directly beneath your bladder, wrapped around the upper section of your urethra. In a young man, it is roughly the size of a walnut. But beginning in your 40s, and accelerating significantly through your 50s and 60s, most men experience what is called benign prostatic hyperplasia, which simply means the prostate begins to grow. As it grows, it does not only compress the urethra and cause the urinary symptoms you may already recognize. It also begins pressing against the neurovascular bundle, a dense cluster of blood vessels and nerves that runs directly alongside the prostate gland and supplies the erectile tissue of the penis. When that neurovascular bundle is compressed by an enlarged, inflamed prostate, blood flow to the penis decreases. Nerve signaling becomes sluggish. The erectile response slows and weakens. And morning erections, which are not just a sign of sexual health, but the body's natural mechanism for oxygenating and maintaining the health of penile tissue overnight, become weaker, shorter, and less frequent, until many men stop noticing them at all. Here is the number that should stop you mid-thought. Research consistently shows that between 72 and 80% of men with clinically enlarged prostates also report measurable erectile dysfunction. 72 to 80%. This is not a coincidence. This is anatomy. These two conditions share the same structural root, and they respond to the same upstream treatment. And yet the medical system almost never addresses them together. Men receive one prescription for urinary symptoms and a separate one for erectile dysfunction, and nobody addresses the single underlying cause driving both. That is exactly what we are going to change today. So where does tomato juice fit into this? Tomatoes are one of the richest natural sources of a compound called lycopene, a carotenoid that gives tomatoes, watermelon, and pink grapefruit their deep red color. Lycopene is what researchers call a tissue-selective antioxidant. It does not distribute evenly across the body the way many nutrients do. It seeks out and concentrates specifically in prostate tissue, accumulating there at levels roughly 10 times higher than anywhere else in the bloodstream. Once it arrives at the prostate, lycopene does three things that directly relate to everything we have just discussed. First, it reduces oxidative stress inside prostate cells, slowing the cellular damage that drives the gland to keep growing. Second, it reduces local inflammation in the prostate tissue, which directly takes pressure off that neurovascular bundle. And third, multiple peer-reviewed studies have shown that consistent lycopene intake is associated with measurable reductions in prostate volume and in PSA, the biomarker we use to track prostate cell activity. One study published in the Journal of the National Cancer Institute followed men with prostate concerns who consumed lycopene-rich tomato products daily. After just 3 weeks, prostate-specific antigen levels dropped significantly. Over longer periods, prostate volume decreased in the majority of participants. So if lycopene is this powerful, why isn't every doctor simply telling men to drink tomato juice every morning? Because by itself, lycopene barely reaches its target. This is the part nobody tells you. Lycopene is fat-soluble, which means your digestive system cannot absorb it efficiently from cold or raw juice alone. When you drink a glass of plain tomato juice, even high-quality fresh juice, less than 10% of the lycopene in that glass successfully crosses your intestinal wall and enters your bloodstream. The rest passes through you completely unused. Your prostate is sitting there, specifically designed to uptake this compound, and your body cannot deliver it. So the question becomes, what single ingredient could you add to that glass of tomato juice that would act as a molecular delivery system? What could escort lycopene through the intestinal wall, dramatically increase the amount reaching the bloodstream, and simultaneously add a second independent anti-inflammatory action on the prostate itself? The answer has been sitting in Mediterranean kitchens for thousands of years. The ingredient is extra virgin olive oil. I know your first reaction might be, olive oil in tomato juice? Stay with me, because the science behind what happens when these two ingredients meet inside your digestive system is genuinely remarkable, and once I walk you through all 3 layers of the mechanism, you will understand exactly why the results are 3 times faster than either ingredient produces alone. The first layer is bioavailability, what olive oil does to lycopene absorption. When you add a tablespoon of extra virgin olive oil to tomato juice and mix it into an emulsion, the healthy monounsaturated fats in the oil bind to the lycopene molecules in the juice. Fat-soluble compounds like lycopene require the physical presence of fat molecules to be transported across the intestinal wall and into the lymphatic system that delivers them to the bloodstream. Without fat, the lycopene simply cannot cross that barrier efficiently. With olive oil present, the fat molecules act as molecular carriers, binding to lycopene and physically escorting it through the intestinal lining. Studies comparing lycopene absorption with and without dietary fat show that the presence of fat increases lycopene bioavailability by between 200 and 400%. The same glass of tomato juice, with nothing changed except the addition of 1 tablespoon of olive oil, delivers 3 to 4 times more lycopene to your prostate than the plain juice delivers alone. That is not a marginal improvement. That is the difference between a treatment that barely registers and one that your urologist notices at your next appointment. The second layer is independent anti-inflammatory action, what olive oil accomplishes completely separately from lycopene. High-quality cold-pressed extra virgin olive oil contains a compound called oleocanthal. Oleocanthal is a phenolic compound that researchers have shown inhibits the same inflammatory enzymes targeted by ibuprofen, specifically COX-1 and COX-2. In the prostate, where chronic low-grade inflammation is one of the primary drivers of continued glandular growth, this is significant. Oleocanthal does not just reduce the sensation of inflammation. It interrupts the inflammatory signaling cascade at a molecular level, reducing the production of prostaglandins, the compounds that drive inflammatory cell activity in prostate tissue. This is a completely separate biological mechanism from lycopene's antioxidant pathway. 2 mechanisms. 1 combination. While the lycopene is arriving at the prostate and neutralizing oxidative damage, the oleocanthal is simultaneously calming the inflammatory signaling that was driving prostate growth. These 2 processes reinforce each other. Inflammation creates oxidative stress amplifies inflammation. And when you interrupt both cycles simultaneously, the reduction in prostate cellular activity is synergistic, measurably greater than either compound alone could achieve. The third layer is the cascade into sexual function, as the prostate gradually reduces in volume and inflammation. And this is a real, measurable process that unfolds over weeks of consistent daily use. The pressure on the neurovascular bundle begins to ease. The pudendal artery, the primary vessel supplying blood flow to the erectile tissue of the penis, begins to carry blood with less structural resistance. Nerve signaling from the prostate region to the penile tissue begins to restore. And here is something I want you to hold on to, because almost nobody talks about this. The nocturnal erections that begin to return as this process unfolds are not just a sign that things are improving. They are themselves the mechanism of improvement. Every nighttime erection floods the penile tissue with oxygenated blood, preventing the collagen buildup and fibrosis that over time makes erectile dysfunction structural and increasingly permanent. When nocturnal erections stop completely, which happens in men with severe prostate-related vascular compression, the erectile tissue slowly begins to atrophy from oxygen deprivation. When they return, the tissue begins to recover. This combination does not simply restore erections. It intervenes before the window of reversibility closes. I want to pause briefly here, because I realize I have just walked you through a significant amount of physiology in a concentrated way. The prostate erection connection, the lycopene absorption mechanism, oleocanthal's anti-inflammatory action, and the downstream cascade into sexual function. Understanding that system conceptually is one thing. Having a clear day-by-day roadmap to implement it is another. If you want the full protocol laid out in a structured format you can follow from day 1. The exact preparation, the amounts calibrated for men at different stages of prostate health, what to track, and how to adjust as you progress. I put all of that together in my ebook, The 30-Day Sexual Health Reset for Men Over 50. It covers this combination in complete detail alongside several other protocols we discuss on this channel, organized as a 30-day daily guide, so you always know exactly what you are doing and why. The link is in the description below. If what we have covered resonates with you, that is your natural next step. Now let us keep going, because the timeline of what your body actually experiences is what most men most want to know. I want to give you a realistic and specific picture of what to expect. Not broad promises. A real timeline, grounded in research and 2 decades of clinical observation. Weeks 1 and 2. The first changes most men notice are urinary. Nighttime trips to the bathroom begin to decrease. The urgency that woke you at 2 in the morning becomes less insistent. The bladder empties more completely. Sleep quality begins to improve in these early weeks, and this matters enormously for everything that follows, because deep sleep is when the body's testosterone production peaks. Better sleep means a better hormonal environment for every downstream process. Men also frequently report during this phase that joint stiffness and general morning soreness decreases. This is the oleocanthal's systemic anti-inflammatory effect working throughout the body, not only in the prostate. Weeks 3 and 4. This is where most men begin noticing changes in sexual function specifically. Sensitivity returns in the pelvic region. There is often a warmth, a circulation that men describe as feeling like blood moving again in an area that had gradually gone quiet. Some men report waking with morning erections during this phase. Not every morning. Not yet with the reliability of younger years. but the return of something they had quietly convinced themselves was permanently gone. This is the neurovascular bundle decompressing. This is the pudendal artery beginning to carry blood without the constant structural resistance of an inflamed prostate pressing against it. It is not wishful thinking. It is anatomy beginning to normalize. Weeks 5 through 8. Prostate volume, when measured, shows real detectable reduction in men following this protocol consistently. PSA levels begin to normalize. Sexual function continues to improve. Erections become more reliable, more complete, more sustained. The hesitation that men learn to manage, the internal calculation of whether tonight will result in disappointment, begins to lift. Not because of willpower, because the body is doing what the body does when the obstacle is removed. Weeks 10 through 12. Men who complete a consistent 90-day protocol report outcomes that match what the Italian research team documented. Prostate volume reductions averaging 20 to 25%. Meaningful improvements in urinary flow. And sexual health improvements that men in my practice describe with a word I have come to associate with this kind of recovery: relief. Not just performance. Relief. The relief of a body working the way it is designed to work, without effort or anxiety layered on top of every intimate moment. These results require consistency. Every day. Not most days, every day. Lycopene's effect on prostate tissue is cumulative. The anti-inflammatory effects of oleocanthal compound across weeks of sustained delivery. You are not treating a single flare. You are gradually remodeling the cellular environment of the prostate, and that kind of change rewards patients in ways that feel genuinely significant. Let me give you the exact preparation. I call this the prostate reset tonic. Your base is 200 milliliters of tomato juice. Not from concentrate where you can avoid it, and not heavily processed varieties loaded with added sodium. You want 100% tomato juice, whole pressed, organic where accessible. And here is something that surprises many people. Cooked or heated tomato products are actually more potent for lycopene delivery than raw. Heat breaks down the cell walls of the tomato, releasing lycopene and making it significantly more bioavailable, by approximately 35% compared to cold-pressed raw juice. That means good quality canned crushed tomatoes thinned with a small amount of water is an excellent and inexpensive base, and in many respects superior to fresh cold juice. To your tomato base, add 1 full tablespoon of high-quality extra virgin olive oil. The quality question genuinely matters here. The oleocanthal content of olive oil varies enormously between brands and production methods. Cold-pressed, high-phenol olive oil, the kind that has a peppery, slightly bitter finish when you taste it directly from the bottle, is the variety with the highest concentration of active compounds. That peppery sensation is the oleocanthal activating the same receptors that respond to ibuprofen. If your olive oil tastes mild and neutral, it contains very little oleocanthal, and will deliver very little anti-inflammatory effect regardless of quantity. By the oil that gives you a slight burn at the back of the throat when you taste a small amount directly. That sensation is your quality indicator. 1 tablespoon. Not a drizzle. 1 full measured tablespoon. Add a small pinch of sea salt and a pinch of black pepper. Black pepper contains piperine, a bioactive compound shown in research to enhance intestinal absorption of fat-soluble nutrients including lycopene and oleocanthal-related compounds. Small addition, real effect. Stir this vigorously for 30 seconds or blend briefly. You are creating an emulsion, suspending oil droplets throughout the juice so that every sip contains both the lycopene and the fat needed to transport it. Do not simply pour the oil on top and drink. Mix thoroughly. Drink this 20 to 30 minutes before your first meal of the day. Your digestive system absorbs fat-soluble compounds most efficiently in a semi-fasted morning state. The presence of high-fiber foods can bind to lycopene and remove it before absorption occurs. The morning window before breakfast gives the tonic the clearest possible pathway. One practical note: avoid strong antibacterial mouthwash immediately before drinking this. Antibacterial rinses kill the oral microbiome that plays a role in activating phenolic compounds during early digestion. Brushing normally with toothpaste is completely fine. Just skip the harsh antiseptic rinse before this morning ritual. And make this a ritual, not a daily decision. Put the tomato juice and olive oil next to each other on the counter every night before you go to bed. Remove all friction. When something requires a decision every morning, it eventually loses that decision. When it is already waiting for you, it becomes automatic. Rituals outlast willpower every single time. Now let me come back to something I promised you at the beginning. Why men over 70 see faster results from this protocol than men in their 50s? I understand that sounds counterintuitive. Let me explain precisely why it is true. In men in their 50s, the prostate has been enlarging for a shorter period. There is compression on the neurovascular bundle, but typically not yet the degree of chronic inflammatory saturation that develops across decades. In men over 70, the enlarged prostate has often been in a state of chronic low-grade inflammation for 15 to 25 years. The prostate tissue is saturated with inflammatory signaling, prostaglandins, reactive oxygen species, accumulated cellular damage. When you introduce a powerful carotenoid antioxidant and a potent natural COX inhibitor simultaneously into that environment, the biological response is more pronounced precisely because the need is more acute. Prostate cells in older men also upregulate their lycopene receptors in response to chronic oxidative stress. Your body has essentially been calling for this compound for years, and is primed to make use of it the moment it arrives in sufficient quantity. I have seen this pattern repeatedly across more than 2 decades of practice. Men who began this protocol in their late 70s. Men who had been told gently by well-meaning physicians that erectile function and sexual vitality were chapters that had simply closed, came back to my office 2 and 3 months later with outcomes that surprised everyone in the room, including me. I remember one patient, 76 years old, who had not experienced a reliable morning erection in over 7 years. His wife had quietly accepted their new normal. He had too, even though accepting it had cost him something he never quite named in our appointments. 8 weeks into this protocol, he came back with a meaningful PSA reduction. And almost as an aside, he mentioned that something had returned that he thought was gone. He was not demonstrative about it. He just said it quietly, and then he looked out the window for a moment. That is the kind of outcome that reminds me why I do this work. I also want to briefly expand the picture beyond prostate volume alone, because this combination affects more biological systems than most people realize. And understanding the full scope tends to keep men consistent through the early weeks when results are still building. When prostate inflammation decreases, the systemic inflammatory burden in the body decreases alongside it. Inflammation is not contained in one organ. The same signaling pathways active in your prostate are active in your joints, your cardiovascular tissue, your brain. When you calm one persistent center of chronic inflammation, you begin reducing the background noise of inflammation throughout the entire system. Men who follow this protocol consistently for 60 days, or more commonly report improvements in joint comfort, particularly the knees, hips, and lower back. Clearer, more consistent mental focus through the day. More stable afternoon energy without the sharp crash that so many older men have accepted as inevitable. More balanced mood, less of the low-level irritability and emotional flatness that so often accompanies chronic pain and disrupted sleep. And they report, and this is the one that stays with me most, a return of spontaneity. The ability to feel desire without simultaneously calculating the odds of disappointment. The ability to reach for a partner without the mental rehearsal of possible failure. Spontaneity sounds like a small thing until you have lived without it long enough. It is not small. It is one of the last things to leave when sexual health declines, and one of the first to return when health is restored. Your body is not a collection of independent systems operating in separate compartments. Your prostate health, your sleep, your testosterone production, your cardiovascular circulation, your mood, your confidence, and your sexual vitality are all connected. When you address the upstream bottleneck, the downstream systems begin coming back online, not because you forced them, but because you removed what was suppressing them. You are not broken. You are upstream of the fix. If you are ready to take this seriously, committed one day at a time, through a structured 30-day plan. I want to mention one more resource before we close. My ebook, The 30-Day Sexual Health Reset for Men Over 50, was written for men who are done experimenting with scattered information and ready to follow a clear science-backed protocol from beginning to end. It includes this morning tonic in full preparation detail with variations for men with different dietary needs, a complete daily tracking system so you can monitor your own progress week by week, and additional evidence-based combinations targeting testosterone, nighttime circulation, and sleep quality, all working in parallel with what we covered today. What I hear most consistently from men who work through it is that having everything organized in one place is what finally made the difference between intention and follow-through. The link is in the description below. If today gave you the understanding, that ebook gives you the structure to see it all the way through. Let me bring today together. You came to this video because something has changed. A part of your health that once felt reliable has become uncertain. The man you know yourself to be, present, capable, vital, has felt for some time like he is operating at less than full power. And you have been told, or slowly come to assume, that this is simply what age does. I want you to hear this clearly, from a urologist who has spent more than 20 years sitting with men navigating exactly what you are navigating. The decline you are experiencing is not age. It is inflammation. It is a prostate that has been quietly growing, compressing, and restricting the blood flow and nerve signaling your sexual health depends on. And it is a biological system that, given the right inputs consistently delivered, is capable of reversing course in ways that will genuinely surprise you. 200 milliliters of tomato juice, 1 tablespoon of cold-pressed extra virgin olive oil, a pinch of black pepper, every morning, for 90 days. The Prostate Reset Tonic. Less than $2 a day, less than 3 minutes of preparation, and it targets the actual upstream cause of what most older men are struggling with. Not the symptoms, not the downstream effects, but the source. I asked you at the start to drop your age in the comments. If you have not done that yet, please do it now. And while you are there, tell me one thing. Which symptom are you most hoping to see improve first? Urinary symptoms? Morning erections? Stamina? Energy? Desire? Tell me. I read every comment on this channel. I respond when I can. And your comment might be the one that helps another man realize that what he is experiencing has a name, an explanation, and a real path forward. If this video gave you something, a clearer understanding, a reason to take action you hadn't found before, or simply the relief of knowing you have been asking the right questions, please hit the like button. It takes 1 second, and it directly helps this channel reach more men who are searching for exactly this information. Share this with one man who needs it. A friend, a brother, someone you care about who has quietly stopped talking about this part of his life. You do not have to say anything. Just send it. The video does the talking. And subscribe to Vital Health Seniors with the bell turned on. Because next week I am covering the second ingredient in this protocol, the one that works on the 5-alpha reductase pathway, and measurably accelerates the prostate volume reduction you get from this combination. It is an ingredient most men keep in their spice cabinet, and have never once considered for prostate health. You will not want to miss it. The link to the 30-day sexual health reset for men over 50 is in the description. Everything we covered today, fully structured into a clear 30-day daily protocol, is waiting for you there. I am Dr. Mei Anderson. This is Vital Health Seniors. Take good care of yourself, and I will see you in the next video.